Righty, it's Matt and Dyan. Welcome back to OK Aussie. It is Monday, 14th of July. Current time is 2 p.m.
Can you see her, please?
No worries. Oxygen starts at 94, heart rate 74. It's just dropped down from 90s. 201, providing on Downsatron, 4 milligrams sublingual. Let's relax. So Don's not feeling terribly well. We are imminently expecting a crash, so we're just preparing just in case for that situation. She has already had 2 sets of microdosing of clonazepam split, so 1 milligram earlier on and at lunchtime. Normal medications have been applied. Trying to get in front of both dystonia. There were some early indications of blethrosism seen this morning. Sleep stability has been unstable with late sleep onset around 1:30, early onset of sleep rising at about 6 with disturbances. Sleep being the primarily the causation of Dyan with seizures. Temperature is 37.8, Panadol Osteo 665 has just been applied 10 to 15 minutes prior. Dyan's just showing indications of going a bit offline. Heart rate at that time was at 94. It's come down orthostatically to 75. Heart rate's at 93 and dropping a bit. That's 93%. Oxygen saturations. Hey Don.
Yeah.
You look like you're getting a little bit spacey at the moment, sweetie.
Trying steady.
Okay, you don't have to try. You can do whatever you need to do.
I feel yucky.
You feel yucky, do you?
Yeah.
Not surprised, sweetie. It's okay. Good job.
Oh, I know that.
Yeah, that one. I'm sorry. Just relax. Oxygen stats are at 93%, heart rate's at 74 BPM. Just taking a blood pressure reading. Current time is 2:02. So we've got one of Dyan's support staff on site, Namala. She is a nurse, so that's helpful as well. We were waiting for a crash to occur. All indications were there. We've had GI tract related issues with bowel over the last few days. Every time we do that with the gastroparesis, normally by day 2, day 3, atypically 85 to 90% likelihood of causing seizures, normally tied into an electrolyte imbalance as well. Sleep disturbances, we've now had since last Tuesday a week straight of sleep disturbances. Person up above, a new neighbour, causing a lot of noise and disruptions. That's disturbing Dyan's sleep pattern. For me. Thank you, Daddy. Blood pressure for Dyan 112 over 74, heart rate is 75. Dyan's resting heart rate supine should be about 52, 55. It's elevated for her. Her blood pressure should be 80 over 65 supine. So at 112, it's actually 32 points up above. In comparison to her baseline, it's a hypertensive response. So pain, struggling. She's hot. She's 37.8. She's been running 38-degree temperatures for 2 weeks straight consistently, particularly with the onset of the shingles. So that's still active for her. Pain has been high, and neck pain, CCI, and back pain's been very high as well. You can't hear, sweetie? Right ear indications. It's okay. It's okay. It's alright, Papa. You just relax.
Please, little deaf.
Little deaf?
Weird feeling with
Okay.
that.
It's alright. Could be part of your neuroinflammation with the encephalitis. Neuroinflammation, nicotine cause a blockage.
Hot.
You feel very hot. So, current room temperature is 24.5 degrees. Externally, it's 17 degrees. The back door is on, so the room temperature is ideal. Your body temperature is hot. We've just changed sleepwear to make it a lot cooler for Dyan. No indications of dystonia in the lower peripheral. No indications of dystonia in upper peripheral. But Dyan has certainly gone very offline in the last 10 minutes or so.
I'm trying not to.
You're trying not to. It's okay. You do what you do. Okay, you don't get to control this. It's out of your control. Seeing some oromandibular dystonia, so segmented cranial dystonia coming through in the face at the moment, blepharism affecting the eyebrow with some distorted neuropathy, particularly on the right side eyebrow. So we're getting the dystonia happening. You've had already clonazepam. Can you get me a sports drink, electrolyte drink in one of those cups? I'm going to try and get some more electrolytes into them. Oxygen stats are 94%, heart rate is 75 and stable. Do you have any chest pain or anything, Don?
No.
No, you're doing really well. Do you have any pain in your body, in your head? Head. How bad is your head pain?
Mid.
Mid. Pain in your neck as well, sweetie? A little bit. Okay.
Ow.
So you've got some nausea.
Ow. My neck's really bad.
Okay, because you're so fatigued, Dyan saying that her stability of her neck, the CCI, cranial cervical instability, is worsened. So she has been using the soft collar for the neck, which is this one fairly most of the day, to be honest. Oxygen stats are okay at 96, heart rate is dropping down a little bit lower now, so it's 70 and around 69. She's got some electrolytes. Do you mind if you had just have a bit of a drink of that and see if you can get some electrolytes into you? I'm going to bring that forward. Place that down so you can do it. Good girl. Just a little sip for me. Yeah, good girl. Good effort. Do you want some more? Just take your time with the swallowing or the dysphagia. We've got the pulse oximetry on, so we're reading and the alarms are set, so if we get any alerts that hit threshold, we'll hear those. Thresholds for Dyan will be 90% for oxygen saturation, in which case we'll apply the oxygen concentrator to give her supplemental oxygen. The alarms are set for heart rate at 50. 40 will be our concerning point, which we'll then monitor. Appears to be a bit of in and out of syncope occurring as well, and some discomfort.
I made it so much bad.
I'm going to give you some CBD at this stage, sweetie.
CBD?
Yep.
What time am I meant to take it?
Now, it's time. We're going to use it as a PRM. I'm going to give you 0.5 mils of 1010 THC CBD.
Oh.
Okay, coming in. Good girl. Thank you. Oxygen stats are good at 97, heart rate's at 67.
I feel so tired.
You feel so tired. No wonder.
If I had an extra seizure med.
Exactly right. So the last 2 days we've actually added an additional sodium valproate, 200 milligrams into the mix.
Is that gonna work to keep it away?
What will probably do is it might make it more of a protracted seizure. So you might find you're feeling that it goes slowly into the seizure phase. The seizure might not be as intense. It might not be as long in the duration, but it'll feel a bit more awkward for you coming out of it. Blepharism across the right eye is fully closed, left eye is at 25% at the moment. No other signs of segmented cranial dystonia. There is a bit of, so oromandibular going on with the maxilla, so the jaw action coming through. It's a bit more like a lip sucking action. Alright, Bubba.
Okay.
We are here and we will get you through it. Unfortunately, we were expecting this, it was just a matter of when, not if. So I'll take you down.
Today.
You didn't think not today? I would have said that we're probably at DEFCON 4 status at the very least.
I thought.
Yeah, key indicators for you, bowel medications with the GI tract, like I said, by day 3 of taking them consistently, it's always going to throw an electrolyte imbalance. Sleep, when you've had consistent irregular sleep, you're not getting good quality sleep, you're not getting that deep level 3 REM sleep. You have 2 days or more of that, you're almost guaranteed of having them. Stress levels have been a little bit high, haven't they, Namalia? Yeah, so when stress levels are high, that doesn't actually help our body cope. Orthostatic intolerance, we've seen some difference with your blood pressure and heart rates. Okay, let's had some drop-offs. So your oxygen stats are just dropping up and down. You're at 96% at the moment, just coming out of drop-off. Okay. That's going to be your dystonia. You might actually start to go into a focal dystonia with that, sweetie. Don't panic. We've been doing the microdosing of clonazepam over the last 2 days prior to getting top of the dystonia that Dyan's been having on a regular basis. We've only started with a single extra dose of a half tablet, so that's a 1 milligram increase. Hey Maxie, come and say hello. You come and help Mummy. You have been a very good help to Mummy today, haven't you, big boy? Maxie's just there with you, boy. Oxygen stats are at 94%, heart rate's at 71 and dropping. Maxie's right here. Come and give Mummy a hug. Oh, see if you can feel Maxie. Can you see Maxie? Good boy. It's alright, Maxie, I'm right here too, darling. Yes, Mummy's got the funny thing on her hand again. She's a bit out of it. She's not kissing you like normal. Normally she'd be kissing you. I know. She's not able to do that at the moment. Very beautiful. That's sweet. Room temperature is still 24.4, 24.5. Your eyes are heavy, and that's the blepharism. It's causing the eyelid muscles, the eyebrow muscles, to all engage in this dropping down. He's right there. He's there. He's going to keep an eye on you, but it's currently 2:13. It is Monday, 14th of July.
You could go there.
Maximus. That's Mummy's. You can't take her bag. I've got it.
Let's make it support. You're support cat.
Yeah, do your job, Max. We need to get you a little vest that you can wear. Support cat in training. Oxygen stats at 95, heart rate's at 67. Diane's still able to engage, knows where she is in the room and where the cat is.
My eyes are so heavy.
Eyes are heavy. Now Diane's had her lunchtime medication already. That's included the second lot of sodium valproate, so we normally do 3 in the course of a day. She's had the microdosing of the clonazepam, so 1 milligram at that point in time, as well as this morning. So we shouldn't be seeing any of the dystonia. So even though we actually are now seeing segmental cranial dystonia coming through, a bit of bruxism, which is the grinding of the teeth and the jaw thrusting process, it means that it's actually quite strong. So the microdosing's actually helped to reduce and subdue the levels. It's trying to get it just right, that Goldilocks status, you know, not too much, not too little, just in the middle. And it's hard when the variables change. We can't control the sleep variables, the stress variables. On a normal day, I think the microdosing that we're doing has shown that we're getting on top of the dystonia for the last 2 days. Unfortunately, when we have heightened stress, poor sleep quality, bowel-related GI tract issues, and fatigue consistently, the pain levels have been very high. Yesterday and last night, you had a lot of neck, upper back related tension and pain. A lot of migraine, haven't you? Yeah, daily migraines. They're always a neurological indication things aren't going to go well.
That's why I had the extra seizure med. But it makes it do this.
it feels like you're on the cusp of a seizure, but just not going there, isn't it?
But it's like,
If what will commonly happen is it becomes a yuck and it'll be protracted out, but you might not actually go into tonic-clonic seizures. But it does make it feel a bit twilighty and weird, unfortunately, doesn't it?
makes me feel drugged.
Yeah, I know. But what it hopefully does is actually keeps you at that level where you're not going to tick over, you're not going to go into status epilepticus, so we're not having rolling and very complex seizures, and that the seizures aren't very vigorous, and that can cause a lot of injury with subluxations because of your hypermobility. We don't want avulsions or bruising, contusions to occur. Hopefully you'll pass. Right eye is fully closed, left eye is at about 50%. Dyan's itching the right hand side frontalis for some reason. I feel she's feeling either pain or inflammation on the right hand side, just above and around the ear to temporal. Swelling.
The scalp fluid.
Okay, boo. Dyan's been using the normal dosage of furosemide today, so there's been no change there. We haven't applied.
Better than
Yesterday was a really, really bad full body edema day, particularly in the face, neck area. You weren't able to relieve the pitted edema for about 3 hours. Today, it's actually done well. And we haven't had to use the compression stockings today.
Tummy, I don't even know.
Your tummy hasn't gone yet, has it? No, and that's multiple days in a row of quite industrial strength medications. So we'll probably need to do the colonplast.
No.
Yeah, we do. Oh yes.
If she's feeling tight, we can put
Say it again.
If she's feeling tight with hair, we can remove her hair band.
Do you feel if your hair's too tight, Dyan? Namalis is making the suggestion that we can ease off your bun a little bit.
Yes, please take it off.
I'm not going to take it totally off. I'm just going to do that so it's loose, because in case you go into seizure, I don't want your hair flapping around in the way. Oxygen stats are at 97. Heart rate's at 78. Respirations are very low on the diaphragm. Come on, try and do some nice deep breathing for me. That's better off the top. That's good. Good suggestion from the mouth. You can see here how the blepharism is really changing the neuropathy of the facial muscles. I'm putting down with the eye. Would you like some matchsticks to keep your eyes open?
Yeah, in the cartoon.
In the cartoons they do that, don't they? Yes. I'm trying so hard, but I don't know. You can see the control for movements across here. You can see the furrowing of the brow in the space in this location. Interesting, the T-Rex hand position bilaterally. She may be actually feeling pain across the abdominals or the diaphragms, so just keep an eye on that. The dystonia can go into multiple locations, but you're seeing that the lips are pursed and dropping down.
It affects on her face only.
Yeah. So no movement of the feet, no focal dystonia in the hands. Starting to see little twitches, so we're probably going to go into tonic-clonic. They're quite a subdued sort of state at the moment. That's indications of what we're getting. Current time is 2:19 p.m. Heart rate is heightened now at 83. Oxygen stats at 95. The increase in heart rate normally coexists at the same time when we're seeing tonic-clonic seizures. So we'll see an increase by about 15 BPM, and these tics, convulsions across the thoracic is related to that. So our subdued seizures, you'll probably want to try and do a roll if it progresses. So she's got the combination of the segmented cranial dystonia, you see in the face, both of it's happening, amplified across the lip, the upturn of the left cheek. It's alright, sweetie, we're both right here. This will pass. You're doing really, really well, sweetie. No, so we get that ready, just in case we apply. Not going to engage it yet. Hey Google, set timer for 5 minutes.
Sure, 5 minutes. And we're starting now.
Because we've had a minute of full engagement, you can see this is her normal contraction. We should do a left hand roll with tonic-clonic seizures. It's more subdued because we've got the therapeutic level of the sodium valproate. The dystonia is not so good. We're just going to keep an eye on aspiration. You've got a cranial tilt of the head, that's what the jaw's pushing forward. So it's cranial dystonia, whether it's the actual tilt, plus segmented cranial dystonia with the face. You're still seeing engagement across the chest. Right hand's engaged, left hand is engaged in focalized dystonia. Right elbow is locked at the moment through full wrist, so we've got no incursion. You have both feet fully turned in. Okay, it's okay, Gotcha. Oxygen stats are okay at 96, heart rate's at 81, heightened still. Let's see how we go for 5 minutes. If this doesn't break by itself, then we're going to give you some midazolam. Okay. Keep a count on the respiration rate, please. Oxygen sets at 96, heart rate is 80, breathing is a bit shallowed. The muscle contraction around diaphragm, intercostals and esophagus. Release, current time 220. So that terminates that specific seizure set. What we might do is have a few more subdued seizures like that, but you'll still see relaxing should come out of it. Okay, so we've lost the tension through both the hands and the feet. Hey, gorgeous. All right here. It's okay. It's okay. We're all right here. Max is under the covers. Yeah, that was just a seizure. It was a subdued tonic-clonic seizure. And right here, you've also got some dystonia happening simultaneously. And your heart rate's just dropped down another 6 beats because of it coming out, which is good. Oxygen stats are good at 96%. You might have a few more of those, and if it does, I'm going to give you some medications, alright? I know, but I will be.
No.
Yeah, I know, but I will be.
Maybe it's not.
Maybe it's gone. Let's hope it is. You'll probably feel a bit sore and stiff in your neck and your jaw muscles, okay? Transmandibular joint particularly, down the sternocleidomastoid. Yawn indication 222. If we get 3 successive yawns, then we might be out of the tonic-clonics, but I still thought we we're going to have some dystonia, so just keep an eye on the yawn count as we go. Yawns, typically when we get several sets of those, if they're very deep and sustained yawns, are normally indication of relaxation, a release of the muscle tension, normally a conclusion to tonic-clonic seizures. Fingers crossed, but we normally have to wait to get 3 or 4 successive deep yawns at that point in time. Now, just because tonic-clonic seizures might stop, it doesn't mean that the dystonia or myoclonus seizures don't continue, so we keep an eye on those as well. We're still getting segmented cranial dystonia and the jaw thrusting, causing a bit of axial tilt. During this phase, be careful of aspiration, so we're listening for any gurgling. We might need to push to a recovery position for drainage. It should just be a walk by, it's not someone actually at the door, so that's okay. Left focalized dystonia is seen with the curling of certain fingers. We've got mid-tightness of the right hand, right foot, so tension coming across the right fascia muscles of the dorsiflexion. Left jaw thrusting is continuing, seeing some mild thoracic engagement. Oxygen sets at 95, heart rate is 77. Respirations are very shallow, darling. Hey, sweetie. Namara and I are here. You're just having a couple of in and out of seizures at the moment, okay? And some dystonia. It's alright.
I can't wake up.
That's okay. Your alarm's going to go off in a moment. If you have another seizure, I'm going to give you some medication during that seizure, okay? We'll see how you go. Oxygen stats at 95, heart rate is 76. Hey Google, Wake you up, yes. Well, we'll see what your heart wants to do, whether it wants to actually deep yawn at the conclusion of that seizure set as well. Remember, we were looking for 3 to 4 deep successive yawns to give us an indication of conclusion.
It's moving.
You're wriggling your nose?
I'm not.
No, that's part of
Is it
these.
moving?
Yes, it's actually pulling in the muscles, engaging on just that little tip part there. So you also got some furrowing on your brow. So when you've got segmented cranial dystonia, any of the muscles,
Bewitched.
you're a bit like Sabrina in Bewitched. You could wiggle your nose. That's a cool little trick, isn't it? Didn't know you could do that.
Stop.
It stopped. Okay.
I feel so sick.
I can give you some additional ondansetron. Yep, that's no problem at all. These are only the 4 milligram ondansetron, anti-nausea medication. That's the sublingual where it dissolves. Dyan with gastroparesis can have anywhere between 4 to 8 of those in the course of a day normally, depending on the whole GI tract dysfertility. Oxygen stats are 97, heart rate is 80, so a little bit higher than I'd like it to be. Remember, her resting supine heart rate should be around about 52 to 55. When it's increased by about 15 to 20, it's more indications that we've got contractions and other things going on inside the body. Diane's feeling obviously a bit of nausea. She was indicating a need to sit up to try and help quell that. We're not going to go into a full upright position because she might actually then change orthostatically her blood pressure and heart rate, causing orthostatic intolerance and then going into syncope because of the lack of blood flow and oxygen to the brain. So we'll manage her safely with those. It's actually good to bring the head of the bed up. It'll actually increase her heart rate and her blood pressure a little bit. Seizures can quite commonly, both in the pre-ictal and post-ictal phases, bring on the anomia. More in the pre-ictal, just before going into seizures, as you can have the deja vu, you can have tunneling type effects, you can have the nausea, you can have a fear and a dread. There's a lot of different components of pre-ictal just prior to a seizure occurring. Unfortunately, with the dystonia and the contractions of the muscles that occur, particularly if it's working on the abdominis muscles, those in the diaphragm and the intercostals, it can cause those contractions. And with an irregular GI tract as well, it can keep going with the nausea, pushing the nausea into the reflux and into the GERD. So none of those are really much fun. The ondansetron will actually hopefully knock that on the head in the next 5 to 10 minutes. Yeah, sweetie, can you hear me okay? That was just Maxie jumping over there.
You don't tend to vomit now.
No, you don't. Exactly. This type of seizure set for Dyan is what we call the subdued seizure. Just with the medication levels are just below therapeutic, just not enough to actually stop the seizures, but unfortunately tipping over into them. The seizures are slower in the duration. They don't present as vigorously. They might not present as long or as many. But they feel actually worse. I actually think this type of seizure set actually sucks the most. It becomes more protracted and dragged out, and you think, God, will it never end?
I'm more aware.
You're more aware, absolutely.
I don't like being aware.
No,
I want to be
I understand that. But still, as they go on and protracted, we still have to keep an eye on other levels, whether it's heart, oxygen, aspiration type things, and obviously the dystonia I can still see engaged at the moment. That's the birds. Yeah, the budgies that we've got, Australian budgie guards, playing with their enrichment toys. One of them's a bell. Bell's got a bell.
I put a ball up.
You put a ball up there? Well, guess what? I think Bell has taken the ball and you reckon it was Duchess. Max, you need to go and check on your birds. They're doing something. Go on, go and have a look, see what they're doing. Oxygen stats are at 95%, heart rate's at 71.
You have a job to do with me.
Now heart rate will be increased because of the inclination of the bed.
You're my support animal. Oh, why are you not here?
Yeah, Max, you got a job. Come on.
I'm gonna get a dog.
Did you hear that? Mummy's getting a dog.
I'm getting a dog now. You failed.
You're just making my eyes
He's like,
strain.
seriously.
See, the mother passed her nursing. She's a double nurse.
Yes.
She has two nursing
degrees.
You failed me.
Yeah, one job, Max. One job.
You had to lay
Max is
on
our
my-
ragdoll kitten.
You only had to lay on my tummy. Well, not quite my tummy, but my legs.
Legs.
The noise is going away.
Okay, another couple of minutes and the nausea will slow down totally, which is good. You still see the flushness of the face, and if you turn the light on, you'll actually see it's quite red, that mala butterfly rash. Her immune system is already very low, neutropenic. We know that she's running infections. We know that the blood tests are coming back with low white blood, red blood counts, as well as neutropenia.
White as
Yeah.
well.
So, ho hum.
I have too much saliva still.
That's okay. You can tend to over salivate during this. Do you want a sip of water or your sports drink? Give me some. Well, I've only got sports drink. I actually want you to have that, so sorry. I want you to try and keep the electrolytes up. I'm going to take that forward a bit. Good bit, just a little bit at a time.
Yeah, it doesn't work with my tummy.
Yeah. Oxygen stats are 97, heart rate is 77.
I feel off, but I feel like it's the tablets that's made it just linger.
Linger a little bit. Just want to see you recover.
Max, you're doing naughty things.
Can you just wriggle your toes for me, darling, by yourself? Just wriggle your toes, both sets of toes. Good girl.
I can.
We check movement in the lower peripheral just because sometimes with tonic clonic seizures, Dyan can get the Todd's paresis. It happens around about 10 to 15% of the time after quite solid tonic clonic seizures, and atypically around status epilepticus. So we're going for a longer than 5-minute duration. That Todd's paresis normally affects bilaterally, equally both sides, but normally only the lower leg, so the feet and ankles just below the knees. It sometimes extends to the full length of the leg, and in worst case scenarios, it can actually take over to both sets of arms. It can be short duration for about 30 minutes. It can go as long as up to 16 hours, as we've had in the past, which means Dyan can't move, can't walk, totally paralysed. It comes back like an ice cube. It melts away, doesn't it?
But it feels so
It's a weird sensation, isn't it?
when it's there.
Yeah. You're sounding very groggy. You're speaking okay. You've got a very delayed aphasia, so your speech is slower, but you're coming around.
Yes.
Good girl.
Actually, I'm coming back.
Oxygen stats are 96, heart rate 7. I'm just going to take you down a little bit because I want to take a blood pressure. Yeah, I know, but I want to actually see where you're at. Okay. I'm going to wait for 1 minute for her to level herself out, and then we're going to do that. You can get the blood pressure cuff set up for me, and then we'll actually run it. Because of the POTS, postural orthostatic tachycardia syndrome, we'll get a massive difference between sitting up and lying down supine. Anywhere between 15 to 20 milligrams is quite common in blood pressure readings, and heart rate will also be different. Normally need a minute in between for it to settle before we actually take a reading. Oxygen stats are 95, heart rate is 75. Notice yet another one of the quite deepest sort of yawns. I'd still expect to see another couple of yawns before I say, hey, the tonic clonic seizure parts are all over and done with. Dyan's respiration rates are quite shallow and low as well. Let's put the blood pressure cuff on, please.
You.
So try and take that up a little bit higher. See how it's actually encroaching at the moment on the mid band of the arms. So try and take it up a little bit higher on the brachialis.
Arms too small.
That's better.
It's too big, this cup.
Well, it's actually good. Too narrow will actually constrict and you actually get an incorrect reading. So yours is the right size. Placement's everything, unfortunately, when it comes to blood pressure.
More gentle than you.
Oh, really?
Yes.
What's he saying?
She's saying that you're more gentle than I am.
Yeah, she is.
Listen to it. Oxygen stats are at 93%. Heart rate's at 67.
It will come out.
Yeah, no talking during the reading. And because of the pressure as implied, it may cause a bit of syncope or twitching, so I will try to
Just 112 by 74.
Yep. Oxygen stats at 95, heart rate 62.
100 by 68.
So blood pressure has actually reduced for Dyan from the previous reading of 112. It's now gone back down to 100 over 68. Pulse has gone down to 62. So we're actually starting to actually go back down to normal sort of levels for Dyan. Remembering what I'll be looking at is about 85 over 60 and probably a heart rate of around about 52 to 55 to know that yes, she's out of the woods at the moment. Indications are she's able to talk a little bit, but she's still a bit groggy. We're not getting as much syncope as was occurring previously in normal episodes. Another good sustained yawn. I'd say it's the end of the tonic clonic seizures, but will she have some Tourette's, some ticking type action? Will she have some McClonus type jerks? Or will she continue to have dystonia? I don't actually know. Thank you on that one.
This one?
Yeah.
Thank you.
Quite common for Dyan to feel very tired and also feel cold after seizures. So it's okay. It's good that your temperature's gone down.
It's gone down because I'm cold now.
Okay. How's the nausea feeling at the moment?
It's a little bit better. It's much
Okay.
better.
So you've had 2 lots of 4 milligrams, so 8 milligrams in total of ondansetron. You've also had 0.5 mil of CBD THC.
I had 4
The CBD is
milligrams
actually
when I
quite
woke
good
up
as
this
well.
morning.
So you've already had some ondansetron early this morning.
Yeah, I had a Dancertron.
Okay. But remembering too, you've also had some pain
When I
relief,
first
things
woke
like
up
the
this
Panadol
morning.
Osteo. You had some tramadol last night. We actually did 4 drops microdosing of Tramadol. So tramadol oral liquid. So for her to start taking tramadol, you know the pain levels are very, very
and
high.
that helped me get to sleep, but then
Yeah.
waking up. But yeah, it helped me get to sleep originally. But
Okay.
4 drops is good for me,
4 drops is good for you.
but I don't like it.
No, I don't think you like it at all.
I don't want to have it tonight or anything.
No, but we still need to actually address the GI tract related issues and dysmotility, unfortunately, the impaction that's starting to occur across that. We can't actually apply much more of the
My
medications. Fluid retention is throwing that out of balance. Yep. And to do any more is going to put pressure on your heart, causing you to have more angina and probably cause you more electrolyte imbalance, more dystonia.
Yeah.
So we'll probably try the Coloplast liquid enema. We'll actually do a water enema. Is what we'll do. Okay, because that way it's not going to get colonic. So we'll do some colonic work. That way it's not going to cause agitation. It'll just loosen things from the lower bowel. Things that we have to make some decisions over. I think Dyan's actually come around quite cognizantly at this point in time.
Yeah,
Current time is 2:38.
I just feel like my legs are like half asleep and I feel still a little sick, but I'm
Okay.
coming around.
Okay.
Yeah, my legs feel like half.
Let's just have a look at the facial side of things, if you wouldn't mind. Let's do the 3 normal sort of tests that we do. Show me I know.
Goodness.
Poke your tongue out for me as far as you can. Good girl, and relax. Show me a big happy smile. Smile, happy face. Good girl, you have to think about that. And show me your shock as if you're scared. Oh my God. Good, okay. So what we're looking there is bilaterally, everything is equal, both sides. We've got fairly good range of movement going through. So I feel that you've actually released the dystonia cranially in the face. I bet you're going to have a bit of soreness in the neck and all that. That's another one of the good yawn indications. Stiff around the jaw because there's a lot of engagement of those muscles. Dystonia is uncontrollable. It is irregular muscle contractions. It can cause things to posture in weird positions. It can cause things to bend out of shape, not be able to be moved. They can lock, or it can cause some fibrillation or quivering. It comes normally from the basal ganglia, part of the brain, the signaling, the messaging. That's why you've got bilateral calcification of the basal ganglia, known as Farr's condition, when it's in conjunction with a movement.
The same as having a tumour there or something, or is
It's,
it different?
if you want to look at the equivalent, it's when you've got something in the brain that shouldn't be there, then it's going to be causing some messaging or blocking. Yes, it can be working in that same sort of way, absolutely. But the basal ganglia is where the messaging for movement and the muscles come from, and that's why it's causing for her. So you've seen some basic generalized dystonia, some focal dystonia in the hands, some cranial dystonia, which is the tilt, and segmented cranial dystonia, which is the blepharism of the eyes and the oromandibular and the jaw thrusting.
I had an extra sodium valproate, even though it avoided a
bad seizure set.
I guess it keeps me safer, even though I feel worse.
See, what happens with that is, here's the logic behind it. You actually respond to ASMs. ASMs are anti-seizure medications. You respond very well. But our problem with that is that we cannot actually achieve a good, consistent therapeutic level for Don. Part of it might be absorption, part of that is the effect that actually triggers.
I need to talk, like the neurologist could do more.
Oh, I'm sure the neurologist can do a
IV sometimes.
bucket load more, but that's another conversation that we're having with the hospital very, very shortly.
Other medicines to,
but because your medication levels were quite good,
it's good for me.
That's why the tonic clonic seizures that you had were very low level. It's sustained, prolonged, but they weren't vicious, they weren't over vigorous, so the flapping wasn't highly vigorous, which is good because it doesn't cause dislocations, probably won't cause contusions. Okay,
is it safer?
It's safer in that regard, absolutely. But it doesn't feel that wonderful because it feels like you're just on that cusp, you can't release it. They suck a little bit. We haven't had to give emergency midazolam today, so that's really good, so we can put that away.
Good.
You're on the way to recovery, which is nice. The additional microdosing of the clonazepam that we've been doing, I really feel is helping with the dystonia in general. Without that, today's event, and without the additional dosage of the sodium valproate, this would have been a shit show today. This would have been an off-the-chart seizure with all of the different conditions that I've been working on. So we responded well, understanding what your signals, your warning triggers are.
Was a good thing.
Very good thing. I agree.
And I knew with the lack of sleep it would be a sensible thing to do because I was having migraines every time 100%. I woke up.
And you've also noticed that you've been on the cusp of a neurological meltdown. So autistically, when you have this, your meltdown's affected neurologically because of these seizure conditions as well.
I was so irritable, which is not my natural,
it's not your natural
my
state.
Personality. So like when I know that happens, and I know it's not autism meltdown, that's when I know. Normally not before you do. I realise after.
It's a neurological meltdown.
It's like irritability is like my doctor said, didn't he? It's almost like you're going into a seizure when that starts.
And that's rapid thoughts, cyclical thinking, looping conversations, a lot of talking, a lot of emotional difference and imbalance, not able to stabilise that.
I was very, very angry, and I know when that happens and I can't shift it, I always get a seizure after it because normally if I get angry, I can just move on to something else. Yeah, absolutely. Well, you've done very well. I'm glad that we've done those extra bits of medications. We are getting on top of things. If it's like a meltdown for autism going to happen or a irritability of a seizure?
See, neurologically, we see other things around it at the same time. So migraines come in conjunction all the time with this as well. Your speech, you might have more asphasic difficulties with word finding and stuttering. No, you haven't. So no. So your word finding and stuttering, slurring has actually been quite good in that regards.
Has been for a while because I haven't had touch wood. I haven't. I'm not even going to say.
No, exactly. Don't jinx this. Don't want to be jinxed. Guys, look, any of the information that you see today is very specific to Dyan. So we're not medical professionals to give you information on how to get a diagnosis or how to manage your condition. This is Dyan, a person who's got 22q11.2 deletion syndrome. It's a chromosomal condition. It's a rare genetic disease. It is a condition that means she's got a microdeletion on the 22nd chromosome, on the long arm of that chromosome. In fact, she's missing about 40 to 60 genes. 3 million DNA building blocks, 180, 185 clinical symptoms can actually come with this particular condition. 65% of patients with 22q will have seizure and seizure-like conditions. They'll have events such as dystonia. They will have a whole range of different symptoms tied around this. Syncope comes into this as well. GI tract-related issues are there. Hypermobility and risk of subluxation dislocation is part of this as well. A lot of things under this one condition, as well as autism, OCD, ADHD, and of course the Tourette's, high precedence of that as well seen inside of this condition. Thank you very much for watching. We're here to help advocate and educate on the condition, to create awareness about this condition so that you are aware. About 60% of people with 22q will have ADHD. About 30 to 40% will be autistic. It's a genetic condition causing autism for those particular participants. 65% of those participants will also have things like cleft lip, high palate, or some sort of cleft related issue. This is what the condition is about. Thank you very much for watching.
Teeth problems.
Yes, exactly. Caries, enamel related issues, and in seizures and things like dystonia, what we've got to be very careful of is movement of the teeth, crunching down where you're grinding, which is a bruxism, cracking things like the enamels, and of course infection control that comes with all of that too, because you have a lot of immune related issues. Not much fun as well, sad to say. Guys, big thumbs up if encouragement. Dyan has done exceptionally well. She's very tired. She should be going to sleep, but you know what? That would cause disruptive sleep. So she's going to try and just keep awake until night time and hopefully get...
Really there,
I'm not surprised. Think of it like I was talking about with the Todd's paresis, that 15% that you get, you're going to have a numb sensation. You'll probably be able to move it, bingo, but you're going to have that latent sense where you don't get the nerve responses. And if you were to walk, if we would ask you to walk to the toilet right now, you would have a funny walk. Do you want to try and do that? Do you want to try and walk to the toilet? Does that have interest? Yeah, I'd love to see it. No, because Namana's going to be there to catch you. Namana's going to walk in front of you. Walking related issues a lot of time aren't picked up because the patient's still in bed, but this I want to see is her. Namana, stay in front of Dyan rather than behind. Stay right in front of her, and then let's see how she goes with a ataxic sort of walking. She might have little leg drop, so she might not be able to lift her feet up. She's probably going to shuffle her feet more than anything else. Her feet might be a little bit wider than normal gait, so she can walk. Turn around and face me and come back the other direction. Sometimes you'll see tippy toe walk. Sometimes you'll see equine walk, where it's higher pronounced of the leg action. She's not getting much leg lift, so she's shuffling a little bit. The knees are actually in-turned at the moment while she's walking, doing that. But you're able to walk, which is a good indication. Thanks for helping, Namana. I can't feel my legs. I can't feel my legs. I can't feel my legs. She can't feel her legs. Guys, if you're new to the channel, welcome. Don't forget to subscribe, hit that notification bell. Thank you so much for watching and sharing our content, and we will see you in another episode real soon. Bye for now.